Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Welcome to the podcast. Today, I'm excited to introduce Dr. Joseph Carchedi, a board-certified functional medicine physician, international speaker, and founder of the Lower Gwynedd Functional Medicine Institute. With over 25 years of clinical experience in internal and emergency medicine, Dr. Carchedi blends traditional and functional approaches to provide root cause patient-centered care. Dr. Carchedi is certified by the prestigious Institute for Functional Medicine, as well as the integrative medicines, including ABIHM and ACN. He earned his medical degree from the University di Roma La Sapienza in Rome and completed his residency in Chicago at Finch University of Health Sciences. Fluent in English, Italian, and Spanish, Dr. Carchedi connects with a broad range of patients seeking personalized care. His practice focuses on chronic illness, fatigue, hormonal imbalance, immunity, pain, mental health, and preventative care. He incorporates tools like gene analysis, nutritional therapy, IV treatments, and PRP injections while maintaining the option for traditional pharmaceuticals when needed. Dr. Carchedi is also certified medical marijuana provider and passionate advocate for holistic healing. Outside of medicine, he's an avid cyclist and former medical director for the professional cycling teams, and a trained Italian sommelier and a dedicated educator on healing, power of food, supplements, and the Mediterranean lifestyle practices. Dr. Carchedi's mission is simple: to help people live longer, healthier lives through integrative care, empowering them to take charge of their own well-being. Let's welcome Dr. Joseph Carchedi to the show. Hi, Doc.
Hi, Ginger. How you doing?
How you doing?
Good. Very good. Excellent.
Good. Well, thank you for taking the time out of clinic to meet with us today. As you may or may not know, this podcast is inspired me to interview MDs and DOs that have gone into functional and integrative medicine to inspire other NMDs and DOs to do the same. So, hopefully the other MDs and DOs will be listening to this and getting some wisdom from you today. So we know, about your professional background and your functional medicine trained background, but what inspired you to change how you practice medicine?
I come from a European community. I was born in Italy, so when I came over this country, I grew up with practices of the Mediterranean area. So as far as eating is concerned, so when I wound up going to med school and I worked in the emergency room, I found that I was seeing people over and over and over again and not really getting any answers. All I was doing is just putting a little bit of wax on the dike so it wouldn't leak, so to speak. And I came to the conclusion that instead of seeing people over and over again, and by the way, when you see an emergency room physician, you don't remember their names. You're supposed to say, hi, thank you very much, take care of me, and that's it. Well, I was seeing people over and they remember my names.
Oh my goodness.
That wasn't the need for emergency medicine. It's an emergency, you take care of it. If you're a primary care doctor, I understand that. And I was not. So I saw the need to try to create a system that I wanted to find solutions. But working in the emergency room, we are allotted or obligated to be allotted maybe 7 or 8 minutes at the time. And this is in the late 80s and the 90s to actually see a person. And you really can't find out too much about a person in such a short period of time, let alone asking about genetics, lifestyle, family, and all that other type of stuff. You got to get to the nitty gritty. You get the vital signs, take care of it. If they have a heart attack, stabilize them and send them upstairs. If they have a baby, you make sure stabilize, send them upstairs. You're always sending them somewhere. You're never keeping them down there. I found that it was by virtue of meeting the functional medicine community, it was very intrigued me a lot, because you think as a trained physician that you know a lot of what you know, and you do. But you'd be surprised how much little, and most physicians admit to this, that we do not get too much nutritional, biochemical, and physiological information as we go through med school. So we're kind of behind the ball game regarding that. Yes, we know how to give a medication. Yes, we know some of the side effects, but we don't know the entire global aspect of it. And understanding the functional medicine approach gave me the opportunity to investigate this. I kind of connotate it as basically a medical Sherlock Holmes.
Okay.
Find out what's going on and then give potential solutions, modalities, things of that nature itself. And it's kind of intriguing because it surprises you. So, wow, that it really works that way. It really works. Contrary to what people don't think, that, you know, some of the things are not valid. Now, what in the functional medicine concept, even in the integrative, which is kind of an out branching of it, is the fact that you can't do this overnight. It takes us years to acquire allergies or blood pressure issues or cholesterol issues or whatever it is from that standpoint. So you have to find time to try to decipher these type of things and offer potential solutions. And the intriguing thing about it is everyone is different.
Right.
You don't learn that in the med books. You know, you give a medication, you lower the blood pressure, done deal, and that's it. Now, you don't take in consideration the variables, the medication, if it's effective, whether they absorb it correctly, if it's male or female, how old they are. I mean, these factors do influence a lot of people, and we don't have time in the ER, let alone in the hospital, to think about these nuances. So, in this model, this approach is a lot different because of the fact you do address these issues. And these nuances are not small. They wind up being big things sometimes that you'd be surprised of. Some little thing winds up being a very, very big thing overall. So I wound up dabbling in it to the degree that through a time period of like 10 years, I segued from that to 100% emergency medicine into basically doing more functional medicine. And then I decided in the early 2000s to say, that's it. I'm going to do this 100%. And I didn't look back. Now, with that in mind, at the time, and at times still is today, we function through the insurance model. And the insurance model I have found to be true even more so now, that it's very, very limiting. The insurance companies dictate to the doctors, to the practitioners, whomever they are, what they can and cannot do. I'm not beholden to that.
Right.
If I feel something that is scientifically and or medically important, I go down that path to try to find out what it is, whether it be a genetic model or find out modalities of variations of metabolisms, things of that nature that are kind of important. I know it's nitty gritty type stuff, but I'm constantly processing these things over and over again to find out what I can offer the person or the patient to get them on the right path from that standpoint. And that's all dependent upon whether they are willing to follow the path. I always tell everybody, I'm not here to make you a vegan, but on the other hand, if you want to go down that path, we can do that. There are the people that come to see me typically are exasperated, frustrated by lack of solutions.
Right.
The doctors in the system today, they give you a pill and that's it. Now, what interestingly enough is I always use this as an example. When we're 18 or 19, I choose this arbitrarily, everything works. We're young, we're vivacious, we can do an all-nighter, the next morning everything's fine, everything's wonderful. We can conquer the world. So all of a sudden now we're 50 or 60, things don't work as well. Now, the traditional system says, well, you're getting older. Well, the fact of the matter is, yes, you're getting older, but you're no different. Your genes haven't changed. Nothing really has changed, except your choices in life and what you've done to change the expression of your body system from 18 to 50, for example. And what the doctors typically do, as you see these physicians now, and even today in the emergency room, you see them, you have normal blood pressure at 18, you have high blood pressure at 50. You have normal cholesterol at 18, high cholesterol at 50. So what do? Almost exclusively, everyone puts you on a pill. Now, maybe in the 1950s, I was asking the real old timers, what they did at the time, and they knew who you are. They knew how you're doing, how's the wife and kids, how's the husband, what's going on. And they say, well, what are you eating? What are you doing? What have you been exposed to? That's the old time of thinking about things. Today, we don't think that. So that has basically reinstilled for me to reacquire these questions, and I try to find out and develop a model to try to give some insight to the people and try to find out, oh, that's the way it is. Excuse me. And the fact of the matter is also, by giving a pill to a patient for a high blood pressure or cholesterol, and let's be honest, if your cholesterol is high at 50 and it wasn't 18, your blood pressure was not high at 18 and it's high now, most doctors today or practitioners, they'll put you on a medication. And if you look at that scientifically, let's think about this for a second. Are we curing the person? When you give a pill, you do lower the blood pressure or you do lower the cholesterol. But what you don't do is get the solution. You're just lowering it temporarily, but the factors that make you high blood pressure,
right? You're addressing the symptom, not the underlying cause.
Right. So
yes. So you've been doing this a long time. I mean, you started 20 years ago. I mean, hardly anybody was doing functional medicine back then. So that'll kind of move us into the next part of the segment. So obviously you've treated thousands of patients over the last 20 years, but can you share a story about a patient that kind of stands out to you, whose life you significantly improved using a functional or integrative approach? Just one.
I'm going to choose one, but the majority of them are like this.
Okay.
Basically, I found a patient by doing an interview and doing a gene analysis test or whatever. I found that they had a high predisposition toward having high blood pressure or cholesterol.
Okay.
So I said to them, well, what have you done? How were you when you were 18? How was your lifestyle? What were your parents like? Where did you come from? Because you'd be surprised. There was this is a very, very interesting model that I'm very proud of this. When I was in the emergency room, this is in the middle 80s, I had a woman that had an unusual accent. And due to my knowledge in languages, I knew she came from an Eastern Bloc country.
Okay.
So she came to see me because of the fact that she had issues with energy and hair. She was losing hair and things of that nature. She had seen an endocrinologist as well as a internal medicine physician, and no one was able to decipher what was going on with her because they were kind of subtle. So I said to her, I said, oh, interesting. And I noticed her name, and I said to her, interesting. Do you know if you eat lots of shellfish or not? And she says, no. She says, how'd you know about that? And I continue with the discussion. I said, what about the fact that, do you come from an Eastern Bloc country? She says, how'd you know that too? And she's, really? I says, well, I'm just curious. No one's investigated this. Did you live outside of Kiev? And she says, what are you, a psychic? I mean, like, how do you know I lived outside of Kiev? I says, and I'll bet you a little bit of money that you probably were around Chernobyl. And it just so happens that she lived outside of Chernobyl.
Oh, wow.
And no one investigated to find out where, when she was growing up, where she was exposed to.
Wow.
And the reason I went down that path is because I knew people who were exposed to the explosion of Chernobyl who had thyroid issues. And those thyroid issues led to have hypothyroidism. It destroyed the thyroid. They had to get iodine, and one thing led to another. And that was an unusual way of trying to find out what was going on when no one else went down that path. I did it from a social standpoint. Instead, the doctors tried to find another standpoint, but it was so subtle, no one knew the difference. And lo and behold, she wound up being hypothyroid, and we kind of found out that her iodine levels were low, and we supported her with thyroid medication. And that's one of the things. And that was like, wow, that's a great find on my part,
Yeah.
You know.
That's the beauty of this this type of medicine. So yeah, let's talk about, kind of the business model. So, I'm sure, especially 20 years ago, you were, kind of a trailblazer. When you were adopting this approach, I'm sure it brought you challenges. What challenges did you run into, and how did you navigate them?
It was very, very difficult. I'll be honest with you. I mean, when you work in the emergency room, you see people for 8 minutes, and you get done, and there's a biller at the end that they charge the patient through the insurance companies. Okay.
Right.
And due to the acuity of the diagnosis, most insurance companies will pay for that from that standpoint. When I opened up and I started doing the functional medicine, and I went down the path of doing it with an insurance model, and I found out that the insurance companies were not reimbursing for the time that I spent with the patient because of the fact that they didn't feel there was any value of that.
Right.
Furthermore, I have the personal experience. I went down, and since I'm in Pennsylvania, Blue Cross Blue Shield happens to be based in Harrisburg. And I went up there to talk to one of the presidents or vice presidents and ask him a question. I said, listen, I'm in the process of making a functional medicine office, and I would like to know, can we make an agreement, some type of contract that you can send me your patients? I can educate them, okay? And I can avoid you getting open heart surgery, heart transplants, bypasses, whatever, and you can save your company lots of money. And the answer, without any hesitation, no way, don't care, get out of my office. They weren't even interested in actually pursuing that. They're saying basically is, I don't care what you do. I'm not going to give you these patients because I'm going to risk as an insurance company that they die by the time they're 55 or 60. They're not going to get the heart transplant. They're going to die from a heart attack, and that'll be it. And from a business plan, I will make a profit. That's what they were telling me. So I said, well, that's sad. I'm trying to help society and help people and make them understand that they can improve themselves, and you're not giving me the opportunity. So what I wound up doing is I had to make a decision at one point to get away from the insurance model.
Right.
And when I did that, I almost had to close the office because of the fact that I know when people have insurance, they think everything is free and whatever. But even though the insurance companies pay for it, they didn't understand that you have to pay for that type of stuff. So I went down a fee for service model, and for a number of months, it was very, very difficult for me.
Right.
I was still doing some part-time in the ER, trying to make ends meet, but and I almost got to the point that I almost kind of gave up. But for whatever reason, I persevered. And slowly but surely, word of mouth got around that I was sitting with patients for an hour or 2 hours, talking with them, understanding their lifestyle, understanding their work, their family, their genetics, everything what the functional medicine approach does, okay? And they said, that's pretty cool. And then they said, well, after a couple months, they got results.
Right.
And it wasn't a recurrent model, meaning that, you don't go month to month to month and you can continue in perpetuity. You find out what's going on with you, you correct it, and I'll see you later. And I saw these people a year or two later to do some tweaking, so to speak, with the things. So that's where I think that I got word of mouth out of there, and people, one thing led to another until 10 years after, I just totally closed down the insurance model. And by the way, getting out of insurance is more difficult than getting into it.
Right.
They didn't want to let go.
Sure.
Medicare didn't want to let go. Blue Cross Blue Shield didn't want to let go, whatever. And now, as the laws change by the insurance models, I'm set in a very, very good position because of the fact that I don't have to worry about these type of things.
That's
okay?
right. That's right.
And I'm getting quality of life, meaning when I was doing the insurance in the ER, I was seeing 25 patients a day, easily.
Right. Right.
In the office, when I was taking insurance, I was seeing maybe 10 or 15. Now I'm seeing 4, maybe 5.
Right.
And I see the people, I look in their eyes, there's contact, there's camaraderie, there's understanding. We smile, they thank me. And the beauty, this is one of the reasons I got into medicine in the first place.
Of course. Yes, that's what
Yeah.
One of the commonalities that all of the doctors that I've interviewed for this podcast is you're all just so joyful. Like you're really loving what you do. There's so much joy in really being able to help people heal. And I can see it in your faces. I mean, you're healthier too as an individual. So it's just an all around great thing.
And it's fun. And it's fun too.
And it's fun, right?
Yeah.
Exactly.
You know,
A couple more questions for you. So what do you wish someone had told you when you first started practicing this way?
well, that's a good question. It's a time factor. Understand that you can't get solutions immediately. And you need to convey that to the patients, number one. And number two, to persevere. I'm not a 25-year-old. So at the time, advertisement, it's even more important now with the way phones are these days and whatever, social media, things of that nature. It's all come down to that. From that perspective, we have automated everything. You got to stick to your guns. You got to believe in yourself. You really do.
I love that. And what advice would you give to another MD or DO who's thinking about maybe adopting this approach to medicine? They're still in traditional medicine. They're unhappy. They're seeing 50 patients a day. What advice would you give them?
First thing I would do, I would either go to a conference and or speak to one of us.
Okay.
We've gone through the process. We can give them potentially some insight to that degree from that standpoint. It's very interesting. They've done a research statistic that at least in the integrative, I don't know as much, but in the functional medicine model, they found a statistic that the people that are certified practitioners in the Functional Medicine Institute, 17 to 18% of those are ex-emergency room physicians. That is a huge number. Yeah. Now, I granted, I'm one of those people that basically, we burn out. I mean, you get through ER,
a high stress job.
A high stress job, right? And from that standpoint, so you want something gratifying that gives you return and everything else. And they get down this pathway, and basically, it's gratifying. And as long as you understand that, you can ask another. Oh, I did the ER, I did that, I did this, whatever, and I can give them some general guidelines. They just need to persevere.
I love that. So there's a lot of new stuff, and obviously you've been doing this a long time, but you seem like the type of person that likes to keep ahead of the trends and kind of keep your nose in the books. What trends in functional and integrative medicine are you most excited about now?
We've come. This is a constant development of information that's coming out. Interestingly enough, we have arrived now in the 20s. Oh gosh, the 2020s. That that we've gone to the degree of meticulously looking at the genetics of people. Lifespan is important. Quality of life. It used to be important. Now it's paramount. Are you willing to live 90 poorly, or are you willing to live 90 well and happily? Okay, we are getting more and more people in the blue zones in this world that are basically taking care of themselves, eating the right way, living a lifestyle the right way, but they're too and far between now. We have one in the United States in the West Coast, which is kind of unusual, by the way.
Loma Linda. I know. I watched the show.
Yeah, yes, that's true. That's very true. So it's they have certain criteria. But when it comes down to it, there's so much information coming out there. It's difficult to keep up with it. And I'm constantly struggling to get information with the longevity pathways, with the peptides now. We're going down the peptides and everything else. There's a lot out there that we need to absorb from that standpoint. The difficulty that I'm finding out as a physician in the field, that we have to abide by traditional medical models. You can't just arbitrarily take something for the heck of taking it, because traditionally you have to have double-blind placebo-controlled studies all the time. But we as scientists, as physicians, we're able to utilize modalities that are out there without causing any harm, repurposing drugs, things of that nature, to a limited degree. Don't get me wrong. The FDA, they're out there. They're always scrutinizing repurposing drugs, things of that nature, utilizing the repurposed drugs for the COVID effects. Now we're finding out with the substances out there that have not been necessarily validated in the traditional model. One of them is ivermectin, for example. It hasn't been validated, but people are still kind of using it. And give it time, and it will become valid. That's the way medicine works. But they do studies on the degree from that standpoint. But keeping up with the stuff is a paramount job. When I was in the ER, I maybe went to once a year to conferences. I'm going to conferences 3 to 4 times a year. And I don't do
and loving it, right?
Well, I do like it, right? But
yeah,
most doctors historically, I don't know if you've ever been to a conference. They sign in. They sign in. And they go play golf. Yeah. Okay.
Yeah.
We don't do that.
Right.
We sign in. We sit down and we learn.
Right.
And we're interacting and we're asking questions, things of that nature. And we utilize these things when we come back to our offices. Wow, this is pretty cool. And the latest and greatest right off the bat. So it's kind of interesting that we're applying these concepts itself, which is fun, because you go to different centers of the country, and some of them are international, which are even more fun. But the fact of the matter is, expending energy to do that, it takes time from the office, but you're getting up to date. And most doctors, once they finish med school and the residency, other than basically redoing the boards once every 6, 7, or 8 or 10 years, whatever it may be, that's all they know. And they're very, very limited in what to do. And they don't really open their minds too much anymore. I find that the traditional medical model now are very tunnel-minded. They're not open to scientifically utilizing different research projects, things of that nature, which is kind of interesting, because of the fact that if you go to the Ivy League schools, they're doing active research into these fields, but they're not stating anything about it yet, until it becomes important.
Well, we're getting there. All right. So the last question for you then is, what's the one message that you want listeners to take away about functional medicine? What would it be?
Ask lots of questions. Try to find out, you as a person, how you work. Meaning that just because you have a genetic predisposition or a situation, and everyone is different, where you live, your sex, where you've been growing up, how much you weigh, what country you come from, all these variables come into play. And you're not a number. You are not a number, and you are not a number. Most doctors today think of you as a number. And if you go and you see the results of the blood test, they put you under numbers. High, low, you're in between, you're normal. No, you're not normal. Okay?
I love that.
I tell a lot of people that just because you're normal, that doesn't mean you are normal. That means average. Because you may be gifted. And if you're gifted, you should be high. Whereas if you're impaired, metabolically, you should be low. And you need to compensate. And you don't need a medication, because sometimes, as they say in the functional medicine model, food is medicine.
That's right.
So, if you drink too much water, you can die. If you drink too much little water, you can die. So water is not innocuous. Food is not innocuous. Broccoli is not innocuous. There's a lot of things out there that we eat that are beneficial for us. And if you go to other countries, I just want to give this interesting patient that I found, a 23-year-old woman who had ulcerative colitis. She wound up coming to see me. She was scheduled to have a colectomy done, removal of her colon. And she was going to get married with this guy, and she wanted me to follow her so to go through this whole process. And I was more than willing to do that. Now, fact of the matter is, she says, before I do that, I'm getting married, and I'll come back. Then I'll have the surgery. I said, okay. I happen to be board certified in Europe, so she happened to have her honeymoon in Rome, Italy.
Oh,
So what did she do? Now, granted, honeymoons are nice, okay? You relax, you don't do anything, whatever. Stress is minimal. But what did she do? Is she had wine, she had pasta. She didn't do anything that she would normally do. She did over there with no ill effects. Never got one call.
okay.
After her honeymoon, she came back. Within 1 week, all her symptoms came back. And she asked me a very valid question. Do I or do I not have the disease? Do I have to worry about getting my colon out? I said, well, you kind of did the experiment. Your genes are what they are, but the environment made you susceptible or not. Now, I said a sarcastic remark. I said, you can either move to Italy, okay, or you can get your colon out. And unfortunately, I think she wound up getting her colon out.
Oh, that's too bad.
But I mean, she's not going to move to Italy. She didn't speak Italian.
Right.
And she had a new husband, so he was American from that standpoint.
Right.
But the fact of the matter is, just because one is destined to have bad genes, you don't have to get penetrance and expression. You have an ability to intervene and do things. So I think that people need to empower themselves. And through us, we can give you that information, and you can guide your life accordingly and do what you need to do to make your path a good one, happy, healthy, and then empower yourself and then live life and overall do what you need to do. You're not desperate.
Love it. Love it. All right. So that kind of wraps us up for today. So what is the best way to reach you, for other physicians that might be like, you know what, I'd really like to speak to this guy, and, you've been doing it a long time. And if maybe patients are listening that would like to, reach out to you as a physician, what's the best way to reach you, Doc?
Yeah, absolutely. My website is lgfunctionalmedicine.com, and they can get information off of that. Telephone number is 215-780-1898. And I'm open-minded that I can have a brief conversation. I can give a 30-second review.
Love it.
Otherwise, my office manager, she knows the whole 15-minute discussion and get everything that needs to be out there from that standpoint. We work like a family. I work as a team. I work, as a partner in crime to get you where you need to be, and we can go forward from there.
We love it. Thank you so much for taking time out of clinic to be with us here today. Stay with me for a second. We're just going to go through the outro.